Dr. Kovacs, what advice would you have for any of those HR leaders or health care organizations when it comes to addressing provider burnout? What can they do for their workforce?
It's a great question, and we have thousands of people each year that come on our properties across the country that are dealing with that. I mean, they're individually dealing with that concept of burnout and excessive stress that they don't have the skills right now to how to manage. And the beauty is there's a lot of options for people that can help with that. And it's typically not just one or two things. A lot of the time, people will focus on one or two areas, but it's really this integrative approach to addressing the body, mind, and spirit connection. And how do we optimize all three of those paradigms to allow an individual to maximize their capabilities? So, as one of my mentors, Billie Jean King, said, pressure is a privilege. And a lot of people don't realize that the stress that they feel many times is because they're doing something worthwhile and productive and making impact. But it's how do we handle that? And that's what we need to understand. We need to understand, are you doing the right things nutritionally? That plays a big role. How is your sleep? And have you addressed that? And do you understand that? And what little things you can do to sleep a lot better? How is your exercise modalities and when are those applied? The concepts aren't complicated, but understanding each personalized aspect of it is meaning that what I recommend for me is going to be different than what I recommend for you because you have a different profile, you have a different lifestyle, family is completely different, your time constraints are different, and what you enjoy is different. We all know high intensity exercise is a great form of exercise. Zone 2 training, which is lower intensity exercise, is also great exercise. So which one should you do? And we have tests that we can determine that will allow us to know which is better for you based on your makeup. How do you burn fat versus how do you burn carbohydrates? That by itself can play a big role in what you should eat, but also how you should exercise. And then from a mental health perspective, obviously having right strategies. And we use quite a bit of technology now to help people with, if they've got anxiety type symptoms or if they've got mild depression type symptoms, there are a lot of things that we can incorporate in addition to our talk therapy that we're great at, but there's also technology that can be incorporated as well that can help individuals through challenging situations or providing a plan and an action step to deal with environments that aren't as easy for many people to deal with. So as we know, stress and burnout is the arguably biggest problem in the workplace across nearly all industries. But that is partly because we don't necessarily use the right strategies to help individuals work through that. And we see people every day, and that's one of the biggest groups that we deal with is individuals coming to help with plans around that area.